While tourism is slowly returning to normal in Limpopo following the easing of lockdown restrictions, the province is faced with a double whammy of measures to prevent the spread of coronavirus and halt malaria. Limpopo is one of the country's malaria hotspots. To speak about how the province is coping with the pandemic and malaria, we're joined by Limpopo Health MEC Dr. Phophi Ramathuba. Good evening and thank you so much for your time tonight, MEC. Firstly, let's just begin then with COVID-19. I mean, a relatively mild outbreak of COVID-19 in the province. I think you haven't had to deal with what some of the other provinces have had to deal with over the past couple of months.
No, thank you and good evening to you, Cathy, and evening to all your viewers out there. And let me thank you for inviting us. Mm-hmm. Yes, indeed, as Limpopo, we can consider ourselves fortunate because the hard work that was put together by the Provincial Command Council, led by the Premier and all the members of Executive Council, was able to assist in making sure that indeed we find ourselves. For instance, today we only have got 333 active cases. So that tells you that indeed our numbers are still very low and still manageable. We have never find ourselves in a situation where we had cases, even during July when we were peaking. We never find ourselves when we were unable to admit patients, or you wouldn't find an ICU bed or a ventilator for a patient. We anticipated that we were going to see a total of 9,350 cases in terms of the predictions during that time. But up to date, we have just admitted just over 2,000, and I'm talking about both public and private. And even if you look at the number of deaths that were predicted compared to what we currently have, there was a time where we were told that Limpopo will experience more than 1,700 deaths, but we've only registered around 475 deaths. And that tells you that the work that was done and the compliance by the people of Limpopo did assisted us a lot, and we still find ourselves being able to cope. We are currently looking forward to continue to work together, especially now that there's a prediction of another surge. But what we are saying as a province, if you remember one of my first interview with you, I simply said, as a province, we are going to win this battle on the street. We won't win it in ICU because we don't have the luxury of those fancy. We don't even have a single academic hospital. We only have 2 tertiary hospitals and regional hospitals. So our struggle will be at the community, empowering our community, making sure that there's behavioral change, they know how to protect themselves. So even now, as we plan for a research, we are planning based on the community, empowering the community. You'll be coming home now that it's festive season. Many of you are here in Gauteng. You might be reinfected. Some of you think because you were infected in June, maybe you have developed immunity, but the literature has got a lot to say. After 3 months, you might still get infected. So what we are currently doing is to make sure we go back to the community and say, Granny, when your daughter comes back from Gauteng, make sure she's wearing a mask. She must not come closer to you without wearing a mask. She must sanitize before she gives you that food. If we empower them, festive seasons will come and go. Limpopo will still remain safe.
Dr. Ramathuba, when it comes to the response of provinces generally to COVID-19, it seems no province has been exempt from allegations of corruption when it comes to issuing of tenders. And Limpopo in itself is not different. And you as the MEC have also been named and fingered as either having tenders awarded to people that are close to you or those that you have served with under different capacities. Let's talk then about, some of these allegations that have been made and what you are doing to remove the cloud of speculation around whether or not there have been contracts that have been irregularly awarded here.
Thank you very much for asking that particular question. It's going to be impossible for me to remove the cloud that has been put on me by myself. But there are institutions that are put in place by government, which is currently busy with that work. And I've always said, immediately when these allegations were said in the media, which I can tell you, no one can even come and prove that those people are my friends, or I'm even close to. The fact that I've served with an MEC, how many people who are politicians who are coming from Limpopo whom I know? It will never confirm that we are friends. The fact that there is a picture that was taken in a government event, it can never confirm that those are friends. And they are not saying I've given any friends of mine. They are saying relatives of alleged friends of mine. You know, if Cathy, me and you can take a picture attending a baby shower or attending a wedding together, or we are at the Bahamas on holiday, yes, you can justify that people are friends. But for instance, the deputy minister in the president, she's my comrade, that we belong to the very same organization. The fact that we attended the Youth Day celebration and took pictures together, and somebody decided to Photoshop and remove other people in that picture, and remains me and her, that tells you that is malicious. And the very same contract of, it has been investigated. We are waiting for that particular report. Hence I'm saying to you, it's going to be difficult for me to come and convince anyone. But let's get the SIU to prove that indeed MEC Ramathuba was involved in any fraud. Up to date, I've not seen any report that is suggestive of that. We did receive the first phase report from the Auditor General. Just go through it, and you will look into the pricing that have been raised in a number of provinces. The Limpopo province stick to all the notes that the National Treasury has provided. There's no single finding of us inflating the prices. Actually, the very same company that is being alleged to belong to the cousin of the deputy minister and the president has quoted, I think it was around 35 rands, when I see the report now from the AG, on an item that the National Treasury pricing was 108. And that tells you, if indeed I had a role to play, wouldn't I tell her to say, you can still charge up to 100 rand, you are still within the law, if I'm involved in the supply chain. So I've always maintained, I fought COVID-19, understanding my mandate. My responsibility was to protect the people of Limpopo from getting COVID-19. I had an administration which is led by the head of department, who is responsible and must make sure that all this is done according to the law. That is why she's not even, she knows that she must come and account to all that is being said or mentioned. I do not interfere when it comes to issues of supply chain.
And what about the allegations then that say that even when one looks at the full makeup of contracts that have, of companies that received contracts for PPE tenders, that many of those came from the Vembe district, which is an area where you were from?
And correction, I was born in Vembe district. But all my activities, since I left Vembe when I was still a student, I've never went back to stay in Vembe. That's a place where my parents stays. If you trace me, you'll find even my branches of the ANC are in Waterberg. So because maybe I am a vendor-speaking origin, doesn't mean I'm coming from there. And also you want to sell a story, you bring a tribal card. We have gone through those lists. You can go through them. Of all those 200 companies, we could not even count up to 20 that are coming from that particular region. And I felt it was malicious to become and to bring that particular allegation that the companies that were given are coming. Let's look at...
So why do you think the allegations were made to begin with?
We need to this is politics. This is politics, and you must understand how politics are. Hence, I'm saying,
I don't understand how politics are.
You are a journalist.
Tell me, please enlighten me. No, I don't understand.
As a journalist,
how does politics work?
As a journalist, we deal with politics every day, and when we deal with politics every day, people would want to tarnish other people's image. And journalists are not creating these stories; they are given by fellow comrades and fellow politicians to say, here is a story that can be able to tarnish this particular MEC. But what I'm always saying, can we get the report from the structures that have been appointed? The president signed the proclamation on SIU. if we are to wait for that, I wish they could come up with that particular report so that we can deal with things that we are to, not newspaper articles. And coming to this issue of tribal, that's what I'm saying. This story is, you know, the people that it's alleged that are my close friend, which is MEC Onika, former MEC Onika Muloi. She's not even coming from Vembe. Her daughter is not even coming from Vembe. The very same MEC deputy minister, she's not a vendor speaking. So you know, you contradict yourself. On the other side, you say the companies that are being given are coming from Vembe so that you sell the tribal card. On the other side, you say, no, it's the friends of the MEC. So for me, I'm saying all these allegations are unfounded. Where I'm sitting, I'm clear with my conscience. I know my mandate. My responsibility is to make sure that all the patients in Limpopo who've got COVID receive treatment. Is to make sure that I go on the street, empower my people with knowledge and to understand how to protect themselves from COVID. Right. The HOD must make sure that the PPEs must be procured, and she must make sure that they are procured within the law. If she breaks the law, she will have to account. She can never come even a single day and say, MEC told me these are the people you must give that, because that's not how I operate.
All right. Dr. Ramathuba, we're quickly running out of time, but I want us to talk about malaria, because we know that what COVID-19 has also done is that the responses to other diseases that take place in our communities has been receiving much less attention than they usually would do. So talk to us about the situation that we're facing in terms of malaria, very briefly, please.
Yeah, briefly to tell you that we have come a long way. 2017-18, we had more than 18,000 cases of malaria with 160 deaths. In the last financial year, every year we're reducing by even more than 70%. In the last financial year, we only registered 3,000 malaria cases with 19 deaths. This year, what we did, you remember when we launched our approach towards the surge of COVID-19, we said we are going to have a community-based approach towards the surge, wherein we release more than around 10,000 community healthcare workers. We allocate them household. When they go to that household, they have got professional nurses accompany them. We were not only screening for COVID-19, we will also screen you for your diabetes, for your hypertension, in areas like Mupani and Vembe, which are malaria endemic area. They had the malaria test kits. That is why up to so far, we only registered 2 deaths for malaria. We have done well in terms of fighting malaria, and come Thursday, I will be in a village, somewhere Madimbo, 300 kilometers from Polokwane, wherein that is another area which is still a bit of a challenge. We will be doing our indoor residual spraying, because we have started doing it even during the lockdown, where we said in preparation from September, we started to release our community. We have appointed those malaria sprayers who are coming from the same community. So we'll be doing the indoor residual spraying. And also we are continuing with our message to say, those who are visiting Limpopo, as you have indicated in the beginning, that is a beautiful place for tourism. It's a destination that you must choose come this particular festive season. We've got low COVID-19 infection rate, we've got low mortality rate, but we've got the beautiful site for you to see the Big Five. If you are visiting Kruger National Park, here are the tips. Make sure that you go to your nearest doctor. Your physician will give you prophylaxis before, at least visit them 2 weeks before, so that they can advise you. They will give you malaria prophylaxis. When you get to our areas, please make sure that before sunset you come back to the room and use your fan, use your aircon. Mosquitoes will not tolerate that. Apply all those insecticides, burn the coils, and do that. You will come back still safe, because Limpopo is a beautiful province to welcome all the visitors.
Dr. Ramathuba, we're going to have to leave it there for tonight. Thank you so much for coming into studio this evening. Dr. Phophi Ramathuba, she's the Limpopo Health MEC. All right.